Welcome to FDR's Trend Micro YouTube channel. Today we're introducing the latest research paper, Securing Connected Hospitals, a research on exposed medical systems and supply chain risk. In our latest research paper on healthcare cybersecurity, Securing Connected Hospitals, which is produced in partnership with HITRUST, we examine internet-connected medical-related devices and systems such as databases, hospital admin consoles, and medical devices. We also looked into the supply chain, which has been an attack vector that is often overlooked. What areas are at high risk of being targeted? Based on our research into cyber threats against hospitals, we have identified three broad areas of interest: hospital operations, data privacy, and patient health. Hospital operations include cyber threats against everyday critical systems such as staff scheduling databases, hospital paging systems, building controls, pneumatic tube transport systems, inventory systems, payroll, and administration. Data privacy includes cyber threats against different types of data, such as personal identifiable information for both patients and hospital employees, including patient diagnosis and treatment data, insurance and financial information, research and drug trial data, payroll, and intellectual property. Patient health includes cyber threats against medical devices and systems that are used for treatment, monitoring, diagnosis of patients, as well as cyber threats against the hospital information system. Why do hospitals have poor cybersecurity? There are usually low budgets for IT security. There's also medical devices that are still being used in hospitals that may not meet the requirements of HITRUST Common Security Framework. Older medical devices may no longer have support, and there's usually no dedicated cybersecurity response team. For our research, we searched for exposed devices in hospitals and clinics using Shodan, a search engine for internet-connected devices. The exposed information we were able to locate includes exposed medical images, protocols, databases, exposed industrial controllers, and healthcare systems. We found digital imaging and communications in medicine DICOM systems exposed to the internet, including those owned by 21 universities. These systems can expose images for procedures such as CT, MRIs, PET scans, ultrasound, X-rays, and endoscopy. Exposed medical systems potentially jeopardize critical data such as patients' PII and medical records. The United States had the most exposed DICOM servers according to our findings in Shodan. We also found exposed electronic medical records. Another aspect of healthcare networks that we explored more threats to the hospital supply chain. Supply chain threats are a potential risk associated with suppliers of goods and services to the healthcare organizations where a perpetrator can exfiltrate confidential and sensitive information, introduce an unwanted function or design, disrupt daily operations, manipulate data, install malicious software, introduce counterfeit devices, and affect business continuity. In 2016, 30% of breaches were due to third-party vendor breaches. This ends our quick tour of Securing Connected Hospitals, a research on exposed medical systems and supply chain risk.